The National Health Summit by the Nation Media Group kicked off today at the KICC, turning the spotlight on Kenya's journey toward achieving UHC, with the summit seeking to assess the country is on the right track and to explore practical solutions across various sectors that can support the realization of UHC. Day one featured discussions on the progress made so far, the persistent challenges and collaborative strategies to ensure that quality, accessible healthcare becomes a reality for all Kenyans. Mercy Chalangat brings us this story.
The World Health Organization, in its 2023 Global Monitoring Report, stated that the world is off track in making progress towards universal health coverage by 2030. Nation Media Group's Chief Corporate Affairs and Partnerships Officer Monica Ndongo opened the summit with an urgent call to action to provide quality, affordable healthcare to all Kenyans, especially those in marginalized regions.
This summit arrives at a critical juncture for healthcare in Kenya. Some of the data paints a stark picture of some of the challenges we face. There's a significant burden of both communicable and non-communicable diseases, but there's also great progress around maternal and child mortality rates, though they still demand urgent attention. Issues like access to quality healthcare, affordability, infrastructure limitations, and a shortage of health professionals sometimes impede our journey towards universal health coverage.
Health experts attending the summit called for inclusivity, even as they raised concerns about resource constraints choking the implementation of the universal health coverage.
How we understand UHC is that you're looking at three things. One, what services are provided, which ones are paid for, and who's prioritized in getting the services, because at no day will everyone be able to get all health services for free. The challenge that we face with UHC is to determine how available are the services, how affordable are the services, how acceptable are the services, and are the services of good quality. How well is a person with disability accessing health services? How well is a person living with HIV accessing services? How well is a refugee who is in Kenya being able to access services?
In a bid to accelerate UHC, PS Mary Muthoni said the Ministry of Health is doing a needs assessment for counties to see the counties that need specialists, what to improve, people that need to be trained or hired, and the things that need to be improved in the facilities to ensure that Kenyans access quality health services at affordable prices.
It is not that there's no money for health or there has been no money for health. But many a times is when we used to see budgets reallocated, money that is meant for health, for commodities, for infrastructure, for equipment, reallocated for other functions. And we needed a law to ring fence these amounts so that they can do the work that is intended for.
As the Nation Health Summit continues, experts here have offered the government a number of solutions to accelerate the implementation of UHC. These include rebuilding trust in health systems, formally recruiting community health promoters, promoting the use of technology, and securing funds to ensure prevention and treatment of diseases. Mercy Chalangat, NTV.